Let's try on to the next one, please, Lauren. Thank you. Okay, so what we're trying to capture here, so essentially we're capturing if citizens are currently pregnant, so completion is to help us recognise the needs of pregnant service users. And like most of the questions here and in previous webinars, pregnancy is a legally protected characteristic under the Equality Act. Okay. So just a little bit of data. So there were just under 14,480 live births to women registered in Birmingham. So the total fertility rate is estimated to be around 1.61 children, and that's the national figure there. So our replacement rate, well, the replacement rate is 2.1. So that's the number of children on average that would be needed to kind of keep our population levels the same as they are now. So it's below the replacement rate, both nationally and in Birmingham. And so the stillbirth rate, which I think is Birmingham, apologies for not clarifying that on my slides. So the stillbirth rates, we've got 4.2 stillbirths per 1,000 births. Okay. So why do you want to capture this information? So we're wanting to ensure that we're able to provide respectful and inclusive care and support to people who are pregnant, and making sure that interventions and services can be tailored to meet specific needs and preferences of users at a service level. To help us identify and address health issues and challenges faced by pregnant people, and again, monitoring, evaluation for quality and effectiveness of services, identification of gaps and areas for improvement, and the design and implementation of policies and programmes that aid individuals during pregnancy or whilst trying to get pregnant. Okay, so quite a straightforward question here. So, are you currently pregnant? We have yes, no, not applicable, and do not wish to answer. Okay, so some specific issues to consider here. And potentially difficult question for those that have experienced loss. So just to ensure there's some sensitivity around there, particularly if these are being asked face to face. Non-disclosure, again, so around perceived confidentiality and stigma. So this may be, you know, if you've got kind of young, very young service users, or, you know, or if people are unmarried, like some of the other questions, there might be some questions around the appropriateness or relevance for some services. It very much depends on what your service is. In a lot of cases, obviously, it's a very important question to ask, but others less so. And of course, here we're capturing a single point in time, so this can change quickly. So the question there really, if it's something that is incredibly relevant to the service you're providing, is how regularly you may ask this question again, or you know, ask your service users to ensure that that they update you if that changes. Thanks, Lauren. So we've got a case study here. Again, we've got an awful lot of information here, so it's something you could probably read back on. So again, this is kind of made up scenarios. So for a sexual health provider, developing a scheme to offer sexual health counselling sessions to young people in the area. So some information has been captured at the beginning when attending sessions. So looking at pregnancy, relationships and sexual orientation from the toolkits. The information in the questionnaires, they've been able to identify that fewer people identifying as lesbian sign up for the sessions compared to the census profile. So this enables the provider to then engage with LGBTQ plus groups in the area to raise awareness of the sessions. When I talk about the resources later, so kind of having an understanding of your population in lots of these areas, if you compare them to the benchmark data, so kind of local benchmark data through the census, for example, then you'd be able to see whether there is any underrepresentation potentially in the services that are being provided. So in this situation, so after completion of the sessions, participants fill out the form again, which is including toolbox questions. And in this situation, the provider is able to identify that people who are married or pregnant are the least likely to attend the sessions. So in this situation, so this enables the provider to work on highlighting why sexual health is still important for these groups. So just a couple of things that have been able to be identified there through the toolbox. It would have been difficult to identify those patterns without those. So it's enabled the provider to investigate why people are less likely to engage. So it enables that kind of service development or that more engagement and to perhaps capture people from different groups. Thank you, Lauren. Okay, so mentioned additional resources previously. So the links, the actual physical links to these resources will be provided when these sessions are uploaded for you to refer back to. So I know it's always difficult to grab links. So either when we send you recordings or slides, you will have a full list of links. So we've got the City Observatory here. So an awful lot of information on there around the demography of our city. We've also got the community health profiles. So they focus on different groups to enable a more fuller understanding. And we also will have the Joint Strategic Needs Assessment, which has your high-level dashboards, and also the deep dives as well. So again, to both for benchmarking or for that better depth of understanding.